Imagine a world where each person has a right to a healthy body and mind. While improving healthcare will not solve all problems, healthcare reform could change lives for the better. However, some healthcare reform does more harm than good by misusing funds and neglecting human health. Everybody in the United States has a right to life and to pursue happiness. Healthcare plays an important role in ensuring these rights for all our citizens. Our country may benefit from learning from the successes and failures of other countries' healthcare systems. The World Health Organization Constitution says the highest attainable standard of health is a fundamental right of every human being. With the understanding that material wealth and other characteristics should not limit nor improve access to quality healthcare, we're ready to discuss a few ways to use healthcare reform to improve health systems. Countries can minimize excessive spending without neglecting patient health. One proven method of improving healthcare spending is choosing reasonably priced prescription drugs. A 2020 Ms. Quarterly article found that the United States spent over $3 trillion on healthcare in 2015. Over 10% of this money was spent on prescription drugs. Numerous generic versions of name-brand drugs have been approved by the FDA, which are sold for less money than the name-brand drugs. Prescription drugs improve and even save lives. While most people agree the scientists creating medications should be compensated for their contributions to humanity, we must consider the importance of access to medication. Overpriced medications cost more money than they should, which results in patients struggling to receive life-saving medication. The Commonwealth Fund found that transparency in medication development and distribution, government involvement in pharmaceutical development, and competition between companies can reduce costs while improving patient outcomes. While no health ranking is perfect, many qualities in health systems are universally accepted as necessary for a healthcare system to be considered effective. One Harvard academic believes a successful system ensures timely access to high-quality, affordable care, and one that also promotes innovation of new tests and treatments. Based on these qualities, they found that Switzerland and Germany had the most successful healthcare systems. Switzerland has a healthcare system run nearly entirely by its federal government. Germany's government-run healthcare program covers medically necessary services and most health services for elderly and disabled people. Most German citizens have private or state-funded insurance to cover other health services. The United States is ranked among the best countries for healthcare. However, the U.S. is not the best when it comes to healthcare equity and affordability. Some countries have found that a government-run healthcare system can save money. For instance, the U.S. spent an average of $11,000 on healthcare per person in 2018 compared to $6,000 per person in Denmark. The United States has an under 5 mortality rate of 6 deaths per 1,000 live births compared to 2 in Finland. Additionally, according to the World Bank, the U.S. has a life expectancy of 78 years compared to 81 years in Canada and the United Kingdom. The United States has proven time and time again to be a country of prosperity and continuous improvement. Healthcare reform could help our country better care for our citizens. Healthcare reform is a hot topic in political circles due to the complexity of health systems and reform. Equitable access to quality healthcare could ensure the rights of our citizens. Reforming our country's approach to medication development and distribution could save money and lives. One of the United States' best qualities is our ability to learn from other countries. We can implement this practice in our approach to healthcare reform. Despite the inevitable controversy of modifying our healthcare system, the United States has proven to have numerous areas of further improvement in our healthcare system.